Well, certainly making sure that we reduce all the expenses that we can in order to stay viable is a big challenge for all of us. Trying to manage to Medicare is kind of the buzzword of the day, and all of us are trying to look for ways to do that. So I'd say expense reduction, but beyond that, growth. Where I am in Oklahoma, it's very important that we're able to handle extensive growth, which we have had over the last 6 years, and so prioritizing growth opportunities at the same time that we reduce expenses is a challenge. Well, it's pretty significant impact. As an example, in Oklahoma, I started there 6 years ago. I had 3 hospitals. Today I have 17. The reason for that is that standalone hospitals are finding it much more advantageous to join systems, and so that we can combine and use back office functions as an example and save money in that way. And then in preparation for ACO and making sure that we work together and are able to charge patients in that manner, it becomes more and more difficult to be independent. As I go around the country, the one thing I say that I think executives have to be able to do is not only look at the opportunity in front of you, but the opportunity beyond that. So that as you think strategically, it's easy to identify this opportunity, but with the world changing around you, you have to be able to go beyond that. You know, strategic thinking is it's a talent. And so I think what you need to do as an executive is make sure that either you have that talent yourself or you have team members who do. I'm seeing more and more clinical leaders who take healthcare executive positions. Certainly I have a nursing background myself and have found that very helpful. But as an example, at Convocation on Sunday, I think there were more doctors than I have ever seen walk across that stage. And that's great, because if we're all going to get to some place, meaning that if we're all going to be able to cope with the change that's ahead of us, we can't leave the clinicians behind. And so having clinicians in leadership positions is going to help us all. Well, one of the things that I think is that we are no longer, I believe, a hospital-centric world. As an example, in Mercy, I can't remember the exact numbers, but it was something like 250,000 patients were treated in the inpatient setting, whereas 3 million were treated in the outpatient setting. So as young folks coming up look at careers, I think they need to focus beyond the hospital walls and look at the healthcare system. And that certainly broadens the opportunities for them as well. I think that there is a great deal of opportunity today. It may not be the traditional format that people thought their career would take, but there's definitely a need for leadership today, and I think that there's a bright future for those that go into healthcare leadership positions. I will always be a nurse. I mean, I have a passion for healthcare, but when I looked at where my skills lie, I believe that I could do the best job I could for nursing in a leadership role. What I always say to students is this: for 40 plus years, I woke up every morning and said, thank God I get to go to work today. And if you are not in a position where you can say that, you need to keep searching. And I think that's true no matter what field you work in, but certainly true in healthcare. This is a profession that takes love and passion.